Extreme Makeover by Sharika Magoo. Here's a list of table of contents. I'll take a moment to review. The purpose of this presentation is to explore the need for continuing patient care, discuss ways of healthcare leaders in a complex organization, ways to examine and implement innovation communication, describe the organization mission, vision, and values, describe relational strategies and activities that enhance organization conversations, identify the challenges which may influence the attainment of these goals, and describe key strategies that can enhance organizational conversations. An example of miscommunication occurred on the med-surg floor when a nurse began to transfer a patient without giving a report. On several occasions, upon receiving a patient to the med-surg unit, the emergency room department nurse waits 15 minutes before shift change before she attempts to call for a report. This is the time med-surg nurses are passing medications and making rounds on their patients. No one's at the desk, and the secretaries usually are off work. Nurses who are coming into work, they're getting prepared and they're in the report room. However, no one received a chance to speak to the nurse who was so persistent to transfer this patient. Instead of bringing the patient herself, the nurse sent a student to bring the patient to the floor. The student rolled the patient up to the floor to the assigned room and ran back to the report area, quickly yelling out, "I think the patient is not breathing." Immediately, all the nurses rushed down to the room. The charge nurse pushed the crash cart down to the hall. At this point, no one knows anything about the patient, not the diagnosis, history, or code status. The student was unaware of those answers also. RNs assessed the patient, no breath sounds and no apical heartbeat. We immediately started CPR. One nurse ran and called the code blue and called the house supervisor. The student called the senior nurse in the emergency department of the unit to come to the floor. Another nurse called a healthcare provider and gave information as quickly as possible. While performing a code, a family member came up to the unit and asked what was going on. And when we spoke to the nurse, the charge nurse there, the patient immediately yelled out that the patient was a do not resuscitate and do not resuscitate him. The code team stopped CPR and was very ashamed. The patient's spouse started crying, and the charge nurse, along with the supervisor, spoke with her privately. Miscommunication occurred at the beginning of this situation due to no verbal conversation before a unit transfer. Communication is an essential component of quality health care in a complex organization. There was no relationship between the two units involved nor respect. Relationship building holds the team together like glue and the ability to create groups and organizations that are much greater than the sum of their part. They target individuals to getting involved by pushing them toward bigger and better achievements. A leader with positive and empathetic characteristics works hard to minimize distractions and keep teams collectively high energy, influence one person at a time by listening and by not using her cell phone, wandering thoughts, or multitasking. To quickly form relationships and make people feel safe communicating and knocking down barriers and misperceptions. In fact, in genuine, moral, desirable clinicians through relationship-centered care, one must be capable of integrating multiple disciplinary interactions that take place in a complex system. It is well known if there are strong, clear communication skills in a healthcare provider, the delivery of effective patient care health outcomes. In nursing, there are many challenges faced. It was stress factors. The nurse who was trying to call the unit, no one answered the phone to take her call. It was a staff shortage and patient overload, and she felt that she was being ignored or disrespected by peers. Many organizations have a patient-nurse ratio 7-to-1, which causes a hostile environment. The supervisor did not communicate information about the patient, nor did she know how unstable health condition. The senior nurse authorized to transfer the unstable patient with the minutes who had only minutes to live. And the poor communication between the nurses and the other healthcare providers can have a significant negative effect on other patient safety issues, quality of care, patient outcome, patient and the staff satisfaction. Leaders should promote organizational culture based on the mission visions, also on effective patient-centered and focused on safety. Leading an organization as it relates to communication theme. The leaders are good conversationalists and manipulators using language ethically. And the leaders build mutual respect and capable of giving genuine praises, and these convey integrity and shape trust in relationship. People's compassion are captured by pinpointing the key issues, giving people's voice, helping them feel powerful to express their own emotions and plan of action. The change in mindset of I to us versus me to we. Leaders are compassionate as a point of entry, a deeper conversation on one's own person, so to their own whole person. The conversation in the organization is about a problem, miscommunication, or no communication. Staff members from each unit do not know each other, and the senior nurses doing whatever is best for self, and this is no connection. Often when we receive a report from another nurse does not give her name, even give someone else's name. Effective leaders are visionaries and managers of organization, make sure everyone is doing as they should and make tasks accomplished as planned. They seek to make change. A breakthrough thinking is necessary to move forward. Without culture of openness, it does not happen. A part of learning is unlearning, letting go of old ways of old knowledge and doing things. It may be difficult to do, but it is a skill that prepare one for better ways of doing something. No structure or processes such as language and gestures change from the leader can help staff to be more innovative. After the miscommunication that occurred involving the two departments, staff meeting was held. The meeting was led by the director of nursing, and the meeting was the main purpose of the organization, mission, visions, and values. Acknowledged how the staff viewed and uphold the culture of the organization. As evidenced by the series of events that occurred, the Med-Surg unit charge nurse recommended a good idea for us that we had discussed previously. The idea to broaden our scope, meaning for the nurses to have opportunity to shadow a nursing emergency department and vice versa. The DON agreed, but we were all unsure whether this would occur due to the shortage of staff. She also suggested daily safety and importance of effective communication before transferring a patient, daily huddles, and collaboration for patient safety, putting aside competition and sharing. Our safety success and failures can achieve goals quicker. The meeting was successful. However, some factors were not addressed, such as the senior nurse who had sent the patient and caused the untoward event. This should have been established also as to transfer the patient from unit due to shift change. A time should have been set. Stress factors, which usually occur at the end of the shift, also related to the integrity and professionalism. Also, no exception should be for a patient to be sent to a unit without a nurse giving report to a nurse on that unit. I think the meeting was a temporary stabilizer of the themes listed. Poor habits will continue into the organization, and the leadership of the organization does not have control or power to effectively change the system. Often poor communication patterns occur, and this nurse is hesitant to ensure their concern. Nurses are hesitant to ensure that concerns are being heard and acted upon because that was not the first communication issue. Unfortunately, a culture of hierarchy and a power differential between nurses still exists in many institutions. And if a nurse makes a recommendation and brings an issue forward, and recommendations and concerns is dismissed. A complex organization is evidence-based healthcare and a pattern of relating and meaning. It provides the basis of ways of thinking. They are open to ideas and fields of thought, although they may be more than just one right way or one right answer. The senior nurse felt like it was okay to send a patient to another unit without giving a report because she had done it before without being questioned. However, the seniority in the emergency department never had been implemented tends to make her feel like she's dominant and valuable. Due to the lack of innovative knowledge, the resources she was adapted her patterns of thinking. The patterns of meaning making may result in identification gap in the evidence of misalignment of the evidence presented. People who are skilled in innovation have habitual ways of talking and conversations. Patterns are relating to the clinical practice guidelines instead of implementing by commitment and how staff relates to each other. Staff feels like these meetings are not effective due to the problems brought forward and nothing being done. Therefore, staff members do not attend meetings, and they are thinking that then they already have it. Saying they're never changing their way of thinking, and they are unaware of the innovations that leads to misunderstanding in the organization. The innovational ways of listening, talking, and being mindful within a complex organization relate to day-to-day interaction, emerge patterns of relating in complex relational organizations. Innovation ways of listening are observation and listening with open heart, mind, and will. It is enabled by gestures such as facial expressions and hand movements. Response create a kind of collective understanding. Generally, paying attention is an important aspect of collaborating communication process. In the staff meeting, cues were evident that people were paying attention and listening. However, the language used was the traditional and not transform meaning. Innovation taking a language with influence the path of in the conversation enables one to believe that what is being said is true. Mindful is the energy of being aware and awake in the present moment in time. The leader did not reflect to certain issues as far as the nurses broaden the scope, but did build and represent ideas for the problem, and there was no follow-up to the repetition of the problem occurring on the unit. Reflect and rewrite. 1 hour before the shift change, the house supervisor called and spoke with the nurse about a patient being admitted to room 303. She discussed the patient diagnosis and code status, and the charge nurse assigned the patient to another nurse. Moments after the call ended, one of the nurses called in the emergency department and asked for the nurse who was receiving the patient going to room 303. The nurse was not available, therefore the charge nurse took report on the patient. The diagnosis, history, code, status was given a report. The charge nurse hung up and went to find the nurse who was going to receive the patient and gave her report. This nurse finished up what she was doing and prepared the room for the patient, and the spouse and family arrived to the room first. The transporter came with the patient on the stretcher, and when the patient became unresponsive, 2 nurses verified it. A phone call was placed to the provider and supervisor, and a complimentary card was set aside with clinics and a deceased bedside patient. Working within a complex organization is the foundation of this perspective, are found in the specific complex science responsive process. The principles of emergence and self-organization are the basis of understanding the organization as formed by patterns of meaning and relating. An organization mission and visions served as a pattern meaning that informs the collective organizational identity. Every individual in the organization who are mission-driven and responsible would influence the priorities and make a difference if focused on patient care. People interact with each other, form an organization culture, through patterns of relating. Their habits of relating may be different as a reference of face-to-face communication, but every